So I will turn it over in just a minute to two of our staff members at ACES Connection who are hosting our discussion. My name is Allison Sabula, and I am a community facilitator with ACES Connection for the Northeast and Mid-Atlantic region. If you are joining from that region today and you are looking to get more connected, feel free to send me an email, and I will put that in the chat. So as we move through the program, please feel free to type your question or comment into the chat. And then what will happen is that if we can get to your question or comment, and we will try our best to do that, we will invite you to unmute yourself. I will make that option available, and then you can say your question or comment out loud. So if you have any questions for me, please feel free to put those in the chat. And without further ado, I'd love to introduce you to Laurie Udesky. She is one of our journalists, staff writers at ACES Connection.
Hi, thanks so much, Allison. I am also the manager of the ACES and Pediatrics community. And we were thinking, when we were thinking about a brainstorming session, we're thinking, well, here we are in COVID-19, and so one of the main things that we would like to do now is break down silos. So I talked to my colleague, Karen Clemmer, who is a community facilitator, which will fill you in on all the areas that she covers, but she's also the community manager of maternal health, ACES and maternal health. So we thought this is a perfect opportunity to really break down silos and look at some, ideas, thoughts, questions that people have, ways that people are trying to sort of bridge gaps that have been created by sheltering in place, moving to telehealth, all those things. So I just wanted to give you a brief introduction to ACES and Pediatrics. And ACES and Pediatrics is a reform that really goes beyond pediatrics. It's broader in terms of healthcare providers being able to have discussions on it, find tips and resources. There are also original articles. And it's a forum for people to kind of really interact with one another. So I want to go over the questions that we sort of put out to bring you all in and say that these are just conversation starters. People can ask other questions. And I also am really happy that I know for sure a couple pediatricians who have joined us, and one is Dr. Kate Williamson. She is the president of the AAP Orange County chapter in Orange County, California. And I also saw that Dr. Suzanne Frank is also here, who is she's actually, Dr. Frank, I will have you tell me your exact title now. I know you're working with School Health Clinics of Santa Clara County. So I think that if people have questions for them, other people working in pediatrics, they will be responsive to those questions if you want to put those in the chat. And I also want to introduce, just to start with, my colleague, Karen Clemmers. So Karen, why don't you go a little bit more into what you do and what the ACES and maternal health community is about. You're on mute. Karen, you're on mute.
Thank you.
Mm-hmm.
Thank you, Laurie, and thank you for everybody for joining with us. Right now is really an intense time, and seeing that you're making space for this conversation is really, I feel a deep sense of gratitude. So my name is Karen Clemmer. I'm actually in Northern California, and in terms of ACES Connection, my work is kind of the northwest quadrant of the nation. But for the purposes of this call, I just want to share a little bit about my background. Laurie was thinking it was of importance, and my background is that I'm a public health nurse, and I'm a public health nurse with an emphasis in maternal, child, and adolescent health. And the reason I share that with an emphasis on maternal substance use and maternal mental illness, the reason I want to share that is I think all of those components are really relevant today when we're looking at people sheltering in place with complex family dynamics and more. So as Laurie said, I am the community manager for the ACEs in Maternal Health community at ACEs Connection. And for anybody that's familiar with ACEs Connection, but not necessarily our communities, I just want to remind you that if you go to the ACEs homepage, at the top, you'll see across the top, it'll say communities. And when you click on that, you'll see more than 300 different communities you can join. So Laurie and I are both talking about 2 of those 300. And ours are interest-based versus geographic. So instead of saying ACEs in Boston or something, we're saying ACEs in Pediatrics and ACEs in maternal mental health. So Laurie, do you want me to give it back to you, or do you want me to continue on a little bit?
Well, I was going to ask, because I know, like, for example, Dr. Williamson is going to be able to join us for like the first part. So I'd like to put a couple questions out there, and Dr. Williamson and Dr. Frank, maybe you can also answer this question. I'm wondering, in terms of transitioning to telehealth in the time of COVID-19, how has that transition been for you all? Can you talk a little bit about that, and what sort of, tweaks you've had to make it work, and any suggestions you may have for others, other peers who are trying to make this work?
And I just want to add that I have made it available for participants in this call to unmute yourself. So just be aware of that as you're listening in, to just mute and unmute if and just be mindful of that. Thank you.
Yeah, and I'd like to dovetail too, as Laurie, I can see quite a few names on the participant list, and I'm sure that many people are bringing a really deep understanding and level of expertise, and I would just open the conversation to everybody. One of the things that I think makes ACEs Connection and this type of format very meaningful is that we have such a diverse participant, like from people who are experiencing something first person to healthcare providers that are trying to address those needs and everything in between. And I think that what we have seen is that every voice matters, and that without that first person experience, that kind of showing some vulnerability and talking about things, that we can't do our job as well either. That information, those golden nuggets, really help inform us as we work with the communities and with each other.
So, Laurie,
so this is a,
oh, there we go.
Hi everyone, I'm Kate Williamson down here in Orange County. And one of the hats I wear, as Laurie mentioned, is the president of AAP Orange County. I am also the chief informaticist for our primary care network at Chalk Children's Hospital. And we are at the end of our 2nd week of having implemented telehealth. And it's been incredibly successful. And right now it's so necessary for 2 reasons. One, it's really important because it is the best way to deliver patient care when we are trying to social distance in many cases. And 2, we can actually get reimbursed for it now, whereas before COVID-19 hit, we couldn't, right? And so first question that everybody's been asking is, how do I take care of my patients and make sure everyone's safe? And number 2, how do I keep a roof over my head and keep a business running? So telehealth really is an answer to both of those things. I also want to say that last night for our Orange County chapter, we had our first chapter chat. And I would invite anybody on here. You don't need to be an AAP Orange County member. If you would like to join, we're going to do that weekly. And we have a lot of information on starting telehealth, from how do I, if I'm a one office or a multi-office practice, how do I do that? What are the platforms? How do I code? We have all of that information pulled together from National AAP, as well as other sources. If you would like access to that, more than happy to share.
So we have a comment that I'd like to invite Mary Beth to go ahead and unmute yourself and share. I see you on
I
mute.
didn't want to share. I didn't want to be on video.
Oh, okay.
Oh well, I can do it. I can handle it.
Great. You look great.
We're with you all the way. Yep.
Okay, now I'm trying. Now, okay, hi. So I work at UC Davis. We were just getting ready to start doing our ACEs screening since the Surgeon General is, encouraging it, and we've been trying to train up our staff and the residents and find the words for all of us, because it's not something we standardly do. And now with many of the visits being over telehealth and families being so stressed, we've been at first thought, crap, what are we going to do? Should we continue doing this? And then we thought, no, this is a great opportunity maybe to really talk about this is an example of toxic stress, and this affects everybody. I'm just wondering if you all have advice on how to maybe teach that and how to introduce that to families, either in person or telehealth, that kind of thing. Thank you.
Thank you, Mary Beth.
So I don't feel like I'm going to have the best answer for that. So if anybody else has implemented ACEs on telehealth, I'd love to hear that thought. But I think the biggest problem, and maybe we can chat here on how to address that, is how to de-identify ACEs. I know that there are two options. Clearly, we can use the de-identified or the identified form. And my understanding is that most practices are using the de-identified, but that might not be accurate. We are, in all of our CHOC primary care practices, using the de-identified form. And so in order to continue that on telehealth, it makes it very difficult. And so I think the only way to maybe work around that is to have the information sent either via email from the parents securely or some other platform. But in order for them to actually read it to you via telehealth is probably not the best way for ACEs to be conducted.
The ACEs screening is just a tool for us to work with trauma and stress. And, at Kaiser Permanente, we did telephone visits for over 10 years and then video visits, and we never charged for that. So we had that experience. Now I work for school health clinics in Santa Clara County. So we went to telehealth, and we, I think it's the whole country, or at least the state of California with Medi-Cal, for the first time, they've approved that we can get reimbursed for telehealth. And so what we're doing, a lot of it is just dealing with the trauma and stress, of the current situation. So I don't think at this point, we have to ask exact questions. We just, we need to be there and to, find out what's going on with people. We know with, a lot of the kids with ADHD and autism, the kid, everybody's at home and there's more problems, behavior problems that parents are working with, 24/7 instead of kids going off to school. And that's what, our nurse practitioners doing a lot of telehealth, are giving advice, also advice on learning and academics. The parents are for the first time having to, really work with the kids on learning, having them understand that learning just isn't academic, that it's almost like when you do unschooling with homeschooling. And then a big issue, and I'm not sure how to address this yet, is the issue of people with kids under 2 years old coming in. We feel that vaccines are still very important for health, that we're, for the under 2-year-olds, we're going to be preventing a lot of health problems, but over 50% of people are afraid to come in. So we're still trying to, it's so important development at that age. So doing developmental, assessment, as much as we can, and anticipatory guidance. But I don't think we have to be at this point. There's so much going on in the family and the stress. I think just talking to people more in general about the effect, of the current situation. The current situation we know exacerbates past adverse child experiences and stresses, but just getting people to do mindfulness with people over the phone, reminding people to keep up their routines, the general things that we can help with now, I think, is where most of the population's at.
Thank you so much, Suzanne. Laurie, do you want to comment on
Well, I wanted, Dr. Frank, I just I wanted to also say that Dr. Frank was the ACEs champion at Kaiser Permanente before she retired and moved on to unretirement, where she is now. And I was curious about, in terms of, are you looking for ways to work around like the immunizations? I wonder if anyone else who's on the call has figured out a workaround for immunization, since that is so important.
We would invite you if you have a comment.
That's what I've been asking. Just how, you know, I feel like if we can develop a relationship with people and helping them, you know, in the non-shot part of the visit over the phone for telehealth, you know, talking about, you know, the nutrition and behavior and what the parents, you know, can be doing at that age and in association with the rest of the family. And so then, yeah, and going from there to transition in to, you know, it's just like with cancer, we don't want people not to go into healthcare to get your cancer treatment. We don't want to have people die from cancer while they're trying to prevent COVID-19. And I mean, sort of a disclaimer with the COVID-19, I just went this morning and had my antibody test done as part of the Stanford University project in association with Santa Clara County, because we're one of the earliest to have one of the higher incidences of the COVID-19. And, you know, working with, you know, Stanford and Harvard and the tech companies and artificial intelligence, that we know to get out of the isolation, we have to get to the point where everybody's checking their temperature at home. We have to do the antibody studies to do the prevalence and the masking, which finally, after working, we've got that under at the CDC to cooperate with healthcare on that. And then from there, they're gradually going to release certain populations out of the self-isolation. So I think, I mean, when we're communicating with the families, you know, we want to make sure that people are talking with the kids about what's going on and that people are working hard, and just want to let people know that, you know, there is more hope than it appears on this issue.
I was just going to say, in terms of the vaccines, you know, I think it's, you know, at this point, everything's a risk versus benefit ratio, right? And so whether you're a one office practice or multi-office practice, it's really going to make a difference how you want to manage that workflow. I know some practices are having patients stay in their car, and they're even going to the car and doing vaccines, which I think is few and far between, but that's always an option. Of course, you can stagger visits if you're a one office practice to having the well visits come in the morning and sick visits come in the afternoon. For my own personal practice, we have 4 offices, so we've been able to designate well only and sick only practices, and feel pretty safe about bringing in our patients to those well offices with, of course, contact protection and not having anybody who's been exposed to anybody who's been sick come in the door, screen both the parents and the children, and take their temperature when they come in. So I think it really just depends on your staff, making sure your staff is protected, what is your actual physical structure of your building, how to protect your patients, and then considering whether or not you can keep your patients safe as they come in.
But, you know, a little bit of problem. Some places we have 95% of our COVID-19 cases aren't being protected. So yeah, getting the temperature of everybody is good, because the studies now that Stanford's doing with the wearables, so that the heart rate's going up and the temperature's going up in people's bodies as measured by the watches, you know, 2 or 3 days before they become symptomatic during the pre-symptomatic stage. So that, yeah, that's good. It just, I think it depends on your locale, because I think here, sitting in a place with very high incidence of COVID-19, you know, people have more apprehension than, so I think, yeah, it depends on your community and working with your local public health department.
I wanted to make one comment that you had said, if it's okay if I add, that I completely agree with. Back to the question about how do we think about ACEs as we're doing all of this, knowing that children and parents whose ACEs scores were lower are increasing secondary to this pandemic. And we also know that child abuse, unfortunately, those numbers are going up as tensions rise in families. So I think, we need to think about ACEs both as that screening form, which gives us objective data, but really the bigger picture is how do we reduce ACEs in family and help to increase their resiliency. And I think, if we can't go ahead and give out ACEs screeners and test for that, that's really not the big picture. The big picture is maybe focusing on the resiliency and understanding that not some families have higher ACEs, but every family has higher ACEs, and jump into talking with families about keeping a schedule, so just as you were saying, keeping a schedule with sleep, with food, so kids aren't snacking throughout the day, but they're actually having specific meals throughout the day, making sure they get 1 or 2 times where they can get outside and exercise, having family huddles throughout the day so that everybody can check in at least once or twice on how they're doing or do some stretching exercises. And I think if we can help reinforce that, and nothing else, just know that, or just share with families that we are here for you. And I think that's the biggest message we've shared with our families. We're not going anywhere. Our doors are open. Our telehealth lines are open. We are here, can help mitigate some of the stress that families are feeling right now.
Thank you. I want to ask, I want to put this question out since you raised it. There are reports, of course, that child abuse is on the rise and domestic violence is on the rise. So as a healthcare provider doing telehealth, what are some ways that one can work within this more sheltering in place framework?
Well, there's clearly limitations when we can't have the family in the office, but those limitations are the same in that we're not going into the homes as a general rule, right? So I think our biggest power as a pediatrician or other pediatric providers is simply to be a place of stability, because we know that when parents' anxiety and frustration increases, that's going to be a direct impact on their children. So for many of us who are seeing families, we know that we're sometimes just as much of a mental health physician for the parents as we are an overall physician for the child. So keeping that in mind, we're continuing to play the same role and addressing their anxious concerns. Sometimes simply just with an opening of, before you get to, oh, let me see that rash, just how are you doing? Tell me about the structure of your day. What are you doing to decrease your stress of you and your family? Those can be some red flags that you might be able to identify by asking those questions. And simply being open and bringing up the question, I think, can help families feel reassured.
This is Karen. So I really appreciate this conversation, and then hearing it from a PEDS perspective, and then maybe stretching that and thinking about the moms, and how are moms or parents or even grandparents being supported in recognizing, like we were mentioning earlier, the higher incidence of child abuse, and we know domestic violence as well. So I'm just curious if that can be folded in terms of a telehealth visit, or if that's sort of seen as something different.
Well, we have
go ahead.
We have behavioral health as part of our organization, so we can, talk with the parent and family if they need more than what our, that what we can offer. Then we can just say, okay, I'm going to have so and so who's my, person who is more who specializes in working with dealing with these issues, and I'll have them call you back, and sort of, so we have behavioral health, telehealth at the same time, that, so if we need to go deeper, or they want, need a longer, more experienced conversation. The thing I was going to ask, which I hadn't thought about till being on this conversation. Is there a way, like if we're on the phone doing a telehealth, can we patch into a CBO, like, you know, like for domestic violence, like we have Nextdoor and Community Solutions in Santa Clara County? And I know, of course, they're not there in the office, but they still have their phones and people going. Is that something that people are seeing that they can patch into them? I just have that as a question.
And I don't know if we're seeing anything on the chat line yet, but it was also a question that relates to one of the questions I posed, which was, how do you do a warm handoff to a community-based organization during COVID-19? And I don't know, you know, it's not maybe specific, but I think, Suzanne, your question is a very good one, and it may be a resource for me to kind of look into doing a story about that, about how warm handoffs are done, you know, if that would be helpful. But I don't know, Kate, if you have heard from anyone in the membership about this particular issue, or similar concerns, or any kind of workarounds in this regard.
So we haven't had many incidents that I am aware of in Orange County that has surfaced up to AAP Orange County. So we have not talked about this as a group, but I know this is a topic that will be coming up on a national level through the American Academy of Pediatrics. It has. And I think this is a really good point, and this is something we are, you know, should be and are doing kind of as it is, but making sure that we have a collaborative effort with all the pediatric advocates within a community. So one thing that I've been working hard to do is make sure that we have therapists, we have school nurses, we have the Department of Public Health, we have our pediatricians, all communicating together, because the challenge that we're having right now, that I think we're all having, is we have so much information dumping into our emails and via text and social media that we're getting information overload. There's a lot of discrepancies in that information, and our patients are getting the same type of overload. So I think step one is just to bring your community together, whether it's reaching out to the leaders of some few community partners via email and saying, hey, let's have a chat once a week. What are your resources? Let's put this onto a shared web page and link to each other's. That, I think, is the first step. And then you can actually start using this telehealth functionality, which we have not yet done, but I think it's something that any of our communities could do, where whether you're on Zoom or another platform, you can invite that other person in, right? That would be ideal, that you could actually have somebody on the receiving end when you have a suspected child abuse case that you can Y in onto your call. So I think we actually have the infrastructure for that, but the communication piece is always the most challenging part, and it's the most important part right now.
I'm wondering too, this is Karen, I'm wondering too about recognizing some early signs or families that have been coming into your office, you've had some questions about, and now we know that they're sheltering and there's probably a greater amount of household stress and distress. What do you do? Like, do you consider that, or do you have a conversation, talk about ways to implement strategies at home in addition to the schedule, but like mindful practices or like kid-friendly opportunities? Maybe they find something on YouTube that they can do, like kid yoga or something like that. I'm just curious about some resilience building emphasis, if there's something like that.
It's a great question, and it's something that our practices wanted to do more of. I mean, I think all practices are very overwhelmed, right? So we're doing one thing at a time. But I think it's good for each practice, whether or not you're a pediatrician, family practice, mental health provider, educator, to figure out what's the best way to get messages to your family. So we have patient portal, but there's some limitations with that, right? Sometimes you can't email blast everybody. Most of us have a social media site that we assume all of our patients are on, but not necessarily. So I think first is just really understanding your communication channels, and then being able to share those resiliency recommendations, which, I mean, we have that accessible everywhere, right? Hospitals are coming up with their own kind of resiliency tools. So I think having that education piece itself is probably the easier part, but making sure to communicate with those families directly is always more of a challenge. I do recommend for any of us who have particular families that we've been working with to just do it's going to take more time, but just do a one-on-one, right? Just call the family and check in. The times where I've called a few families just to see how things are going, it has been so warmly received and so appreciated that I know that the 3 or 4 minutes of my time just calling and checking in was well worth it.
Yeah, we're proactively doing that with the computer, picking out a list of the kids with asthma, list of patients who have hypertension, patients who have diabetes, patients who have ADHD, patients, for different diagnoses, and we're just making a list, and we are proactively calling them. And we found there's just so many people that have lost their jobs, and food is another big issue. Getting people who haven't had to get food resourced, having them match up with food resources. So a lot of it just starts with the basics of shelter and food, and checking in with our patients with that, because we do serve a large homeless community. About 40% of our adults are homeless even before this happened. So so we're trying to proactively do that.
I wanted to invite Reed to share their comments. We got a couple good comments, and we'd like to invite Reed to join the conversation. You can go ahead and unmute yourself, but it has been quite a few minutes, so maybe you stepped away from your computer, and that's okay. Laurie?
There was also, somebody had shared about conferencing in somebody, that if there was a sharing information agreement that was established, that you can do that when, in a situation where you want to have somebody who works in the community on these issues, on any particular issues related to domestic violence or child abuse or what have you. So that was on, and I don't know if who that person was, Allison.
Yeah, I think it is Reed, who's also identified himself as a social worker. And so that's a lens that we haven't really considered so far today. And as I read what he wrote, he says they've received looks like the VA. So I'm assuming he means, I don't know if it's Veterans or Virginia, but statewide hotlines received a 73% increase in calls. This in March 2020 is compared to March 2019. So lots of anti-violence support is needed, IPV, SV. So I appreciate that additional lens and perspective, bringing that perspective into our conversation.
And
so one thing that I was gonna, it's okay.
Go for it.
Virginia, he said Virginia.
I was just going to say, obviously from a legal standpoint, we need to have a consent, but verbal consent is absolutely acceptable on telehealth. So as long as you let the family know before you bring somebody on the call and they verbally consented, and then after the conversation is over, that is documented, that should cross all the T's and dot all the I's that you need to for consent.
That's really important. I appreciate that information. Yeah.
I want to bring up just something that I saw in an ACE Aware webinar that Dr. Alicia Lieberman, who's a child trauma specialist, was on the call, and she was asked about domestic violence situations in telehealth, and she said that one of the things that they've been able to do is she said, this is daring, but you can ask if it's possible to bring the partner on the call and talk to them, normalize that everyone has increased anxiety, reacts like more strongly to situations. And she says, and we have sometimes used that as an opportunity to turn individual therapy into family therapy, which has been helpful in preventing both domestic violence and child abuse. So I will put that in the, I guess we could send it out to people who are on the call, the link to the, actually I may have sent it to you, Allison, the link to the ASA Aware webinar where Dr. Lieberman participated.
Okay, I'll look for it.
Laurie, if it's okay, I have a question, kind of a shift in focus, if the timing works. I'm just curious. We're thinking about children and babies and families and peds, and I'm wondering about pregnant women who are in this situation going to have a very different birthing experience, and whether the pediatricians have found or are seeing any ways that they can integrate a level of support. I think the policies differ from facility to facility, but frequently what we're hearing is that women are, the intention is for women to deliver without anybody to accompany them, which when we think about people with ACEs and we think about birth trauma and all that's brought up in terms of giving birth and the vulnerability of that, just wondering if that has factored in, or maybe it's just too early and so much is happening, it's like a fire hose and it's not something to consider just yet. But I was curious about that.
That hasn't happened at our hospitals. What has happened is the hospitals are trying to get moms out the door as soon as possible. So where they may have stayed 2 nights, maybe they'll stay 1 night. So they're being a little bit more kind of judicious with the time needed to be in the hospital. And the staff is protected. So it's not to share, since they're high risk for sharing COVID-19, but that has not been an issue. One thing that has been brought up, and I was just speaking with Matt Zahn, who's the director for the Department of Public Health in Orange County, is breastfeeding. Clearly important for both mom and baby. And there's not really one definitive recommendation for that in terms of whether or not mom should breastfeed. And it's recommended to just take it on a case-by-case basis. Right now, it is not known that COVID-19 is transferred through the breast milk. So it truly is only through secretions. But clearly when a mom is breastfeeding, she is going to have more direct contact with her baby. It is thought that it would be good for her to wear a mask if she is at high risk for having COVID-19 because she's symptomatic or has tested positive for COVID-19. But nobody is saying that moms can't breastfeed. So it's really just more of an individual thing with that.
Oh, that's very interesting. And we always think about moms whose antibodies maybe can transfer, but yeah, the virus through the breast milk, that's very interesting. Right. Yeah. And that breastfeeding is so protective, right? When we know that moms bond with their babies, and yeah, that in terms of child abuse, it's very protective as well. So this is curious. That's interesting.
Well, I apologize to everyone. I do need to get off the call. I have another call I need to jump on. Thank you so much for having me. And if you would like, I am more than happy to share all of our resources from AAP Orange County, which we are updating daily.
That would be fantastic. Thank you so much for joining. I really appreciate it.
Thanks, you guys. Have a wonderful day. Stay safe and stay sane.
Thank you. So Allison, were there some comments? There were a couple comments. I think something came in from Reed, or maybe.
Sure, yeah. So far, Reed has commented a few times, and we do welcome you, Reed, to unmute yourself and share out loud if you want to. You don't have to, but we welcome you to.
Mm-hmm. Yeah, I'm seeing one of Reed's comments related to giving birth, and he's saying for people here in Virginia that have had issues with doulas and other parents, et cetera, they're accompanying them. It looks like most have only been allowed to have a medical personnel present, which kind of goes back to the issue of vulnerable moms giving birth in difficult situations without that emotional support. And then if we think about compounding that with whether they can breastfeed or not, we know that breastfeeding, once it's established in the process of it, is really protective in terms of that strong oxytocin bond that moms have that is protective for preventing child abuse and neglect. So thank you, Reed. I appreciate your comments. And I appreciate, too, not wanting to speak. I totally get it. So.
Totally fair, yeah.
And it looks like you may have offered a hyperlink to an article, a statement on coronavirus. So as we're talking today, I think, Laurie, did you have another person that was going to speak, or would it be a good time to consider like kind of a life course lens?
Yeah, please go ahead. I think that's a great idea.
I got itchy nose. Okay, so when we're talking and I think of what we're saying and I look at it through a lens that's not specifically pediatrics and not specifically adult medicine, but instead looking at a human being across the life course, which I think for most of us, it's something we understand. But I think bringing it more to the fore of our conversation helps us really address the silos that we were discussing as we started this conversation. When we think about, think about the baby that was just born, right? They're conceived, it's gestation, it's birth, it's early childhood. You know, there's childhood, adolescence, adulthood, early adulthood, et cetera, all the way from preconception till when we pass away. And there's so much nuance and interdependence there. And when we think about adversity and trauma, and almost what we're experiencing now is sort of this universal trauma in terms of COVID-19. And we can just think about how if you're at a different, how it's going to impact us differently depending on where we are on that life course. Like if we were a child, I think, Laurie, you shared a great story of if I'm a child and I'm scared, I might respond differently than if I'm an adult. So, and then just recognizing that those parts all stitch together. And some point down the road, hopefully not too far, we'll be looking back on these times. And I'm just trying to be mindful of what would I look back upon and feel like that was really good to consider, or something like that, you know, as a way to anticipate a hopeful future and some buffering opportunities around parenting and parenting in a really difficult time.
You know, that just made me think of the anecdote that I think we shared offline that I'll share with you, which was another one from Dr. Alicia Lieberman on the webinar, which I thought was very instructive. She was talking with a client who had called her up and was going crazy because her 5-year-old was pretending he was getting the virus and then stiffening up and playing dead, and he kept doing it over and over and over. And she was terrified by it, and she kept yelling at him and telling him to stop, and he wouldn't do it. And so during the course of her session with Dr. Lieberman asked her, so, well, what do you think he's trying to tell you? And the woman said, probably that he's scared. So he comes up for a cuddle during the session. And she asks him, are you afraid you're going to die from COVID-19, you know, from the virus? And he said, well, yeah, I'm concerned. And she was surprised he knew that word. And then she said to him, well, you're not in preschool. It doesn't happen a lot to little kids. And look at all the things we're doing to be safe. We're washing our hands. And she went through a whole series of things to reassure him. And then the next week, the mother reported to Dr. Lieberman that he was no longer really acting out this death, you know, from the virus anymore. So I just, you know, I wonder what other people who are on the line, like, what are some of the ways in which you personally have been finding ways to cope with any, like, either issues about being sheltering in place, or how to make contact either with your healthcare providers or healthcare providers reaching out to your patients?
Those are great questions. I look forward to, and for folks who maybe aren't as comfortable unmuting and speaking up, maybe they could offer some ideas in the chat. That would be great. And if I could, Laurie, not to take us too far off, but just to loop back a couple steps, and I can see that Reed, who may be having some internet connection difficulty, which is why he can't do their mic.
Should we give the call-in number? Is that something that we can provide for it, Allison?
I think it's probably probably okay right now just to have the comments in the chat, and we can all read them, or I'm happy to read it out loud, but I think that Karen has summarized the comments so far.
Yeah, actually what I wanted to point out was the last part of his conversation in the chat is talking about the World Health Organization states that mothers with COVID-19 can breastfeed. So I think when we think about people sheltering in place and babies being vulnerable and wanting to have that attachment that reduces ACEs and promotes bonding and reduces the risk for abusive and neglect, if that's the case, that would be a very important bit of information to know. And Reed, if you have that information, or you could provide a hyperlink in the chat, that would be great. That would be very helpful. Thank you. Appreciate your advocacy for families as you work along in this chat. Thank you.
I wonder, can I also, I was just thinking, and I'm wondering what, like, for example, Dr. Frank, if you could talk about how the people you work with, how everybody's sort of dealing with COVID-19 in terms of work-life balance.
Yeah, we've had, it's challenging, and we've had meetings, I think about once a week between all our clinics, on the, on the computer and via the internet. And people are getting fevers. People are getting COVID-19 symptoms, not necessarily from the clinic, from the community, because, I could just say when I'm reviewing the nurse practitioner charts, I think 30 to 40% of the visits, which are either telehealth or in clinic on any day, are probably COVID-19. We just don't have the testing capability to do that, which we, after we, when we do surveillance for flu, we sort of end up doing that same sort of thing, as we don't test everybody once we know what's going on. And so that's, people are fearful to come to work. People are, other things, people are have people at home who, a lot of employees have people with chronic conditions and elderly at home, and, they're afraid to come into clinic because they don't want to take something back home, and people are asking for notes from the doctor to excuse them from work because they're so afraid to take it back home. We're trying to, keep, have people be open in communication. It's, we know each other, we're our tribe, continuing to, talk, address the issue, and, support each other, and get more personal protective equipment, doing, encouraging, not only encouraging our patients to do deep breathing and mindfulness, but also, ourselves. And and also people are worried because all the children are out of school. So they're coming to work and the kids are at home and they're supposed to be on the computer, doing the learning. And, so that's a lot of guilt about not being with their family.
Mm-hmm. I wonder, I was just thinking in terms of who's on the call. Maybe Allison, I don't know how people would do this, but I'm sort of curious about who is here from what sector, or what, are you a parent?
Sure, Laurie. Yeah, we can invite everyone.
Just trying to get a sense.
Yeah, sure. Yeah, I invite everyone to go ahead and put in the chat, just like we did with our location. Maybe you just want to say, if you're joining us today, as as a parent or as a provider or a social worker, to go ahead and put that in the chat.
A parent.
Yeah, I think. Thank you, Laurie.
A community advocate. A patient,
a person who's just interested, or
a teacher, somebody from the faith-based community.
Yeah,
it could be
health policy.
ACEs Connection, we're multi-sector, so, and everyone's invited.
So we
and we
did home visitor and social worker, public health, and in safe care parent support provider, working with high-risk families to prevent child abuse and neglect, community foundation, behavioral health provider and expecting mother, community foundation, family group decision-making coordinator and family finding specialist, healthcare consultant on ACEs and trauma-informed care, CASA supervisor, coach, mentor, assessor of preschool programs, pediatric primary care psychologist at the Center for Youth Wellness, ACEs Connection staff, hey Elizabeth, who's also a parent, a grandparent, a community advocate, and a family member, psychology postdoctoral fellow, trauma specialist, and a family engagement initiative program director. Great, wow. Thanks for taking that poll, Laurie.
We have this multi-sector group who's on here, and I wonder if you could just brainstorm right now and tell us some things that you would like to know from people from other sector.
Or that you could share too.
Or that you could share from your own sector.
Right, I can see that there's people who like CASA who are working directly with at-risk families, and I'm just curious, like, do you have golden nuggets of something that worked, or do you want to share something that didn't work that you were hoping to get some feedback on? We really want to be a safe place for people to kind of share and exchange ideas. So thank you for asking those questions, Laurie. And yeah. So if folks have some ideas, feel free to type them into the chat. That'd be wonderful. I noticed, I was interested when I could hear Allison listing folks off and being surprised but not surprised that we're seeing Family Resource Center and people who have a child care provider or daycare, or folks who are working in CASA. So for me, those are folks who are really in the front lines of working with families who they often know families really, really well. And those families often are already stretched even before COVID-19. So I'm super grateful for the work that you're doing and the advocacy that I'm imagining that you're doing. If you're here on this call, you're trying to figure out what can you do, what's available. And I know that when our call ends at some point, we do have additional resources. I'd like to say that feel free to type into the dialogue box, the chat box while I'm saying this, but we had an opportunity to receive some materials out of Harvard, and the person is Shali Jaha. She's the Senior Project Coordinator for the Department of Epidemiology at the Harvard T.H. Chan School of Public Health. And they shared some materials for providers that are also relevant for everybody. They're designed for providers when they're speaking with families and when they're speaking with each other. So they have quite a few robust materials in terms of COVID around in Spanish language and some in Chinese. So I think what we can do, maybe if it works, Allison and Laurie, we could share some of those resources so folks can see them, and whichever ones are relevant, they can feel free to print.
What we need to do, because we won't be able to share them in this chat, but what we can do is put them up on our website in a post. So
they'll be in there? Okay.
Yeah, so everyone, I invite you to go to acesconnection.com, and Karen, do you want to do a post after this call and to put those in there, or do you want me to work on that? Okay.
Maybe Laurie and I can kind of collaborate. Maybe we might have different ideas or other lenses and other folks on our team, but yeah, I think pulling together some resources, and maybe now's even a good time to let folks know, I'm not sure, that we are, as ACEs Connection, looking at making sure that COVID-19 resources are readily available to folks. So that's something we're currently working on that's not yet in the front side, but just wanting to let you know.
So, and I also want to say that people who are on this call, we can do other brainstorming sessions with you all that kind of take deep dives into other areas as well. So please also, if you have some other things that you're really wanting to explore with others across sectors, please put those ideas in the chat and we'll arrange them, and we can do more of these. This isn't the only one. We're in the midst of this unprecedented time, and we'll be able to continue to do this.
Are these going to be on Fridays, Laurie? Do we have a time frame on?
I think Allison knows best about that.
I'm not sure if this particular subject is a repeating theme or not, but we do post. Our post will probably be up Monday with next week's schedule, and so I cannot yet confirm. Do you know, Laurie, if you're doing this again?
No. What I'm saying is that I guess I wasn't clear. To be clear is that we're doing regular brainstorming sessions that are, that we decide on as the weeks
Sure,
go on.
Sure.
There's the opportunity for others with different, continue
gotcha.
more based on what your needs are.
Right. I gotcha. That's true.
Mhm.
So if you all have ideas or resources, please feel free to email me, and I can put that again in the chat. Our next one will be a recovery-based theme on Tuesday, the same time and place. So so that will be the next theme that we address. I want to start winding down. And I want to invite everyone to, I'm going to invite a couple of people who have left comments here to share those in just a second, and thank you for those. And then I want to invite everyone that I reposted the communities, the ACEs in Maternal Mental Health and ACEs in Pediatrics, and you are welcome to join those communities. You do that by going to our website, acesconnection.com, and clicking the communities button. As long as you're logged in, then you just click join, and then you're a member of the community. And you can post anytime you want. And so you just click the post button in the upper right-hand corner, and you can make a post including community discussion style posts. You can also post resources and blogs. So we invite you all to do that. Some of you do regularly do that. We love that. Some of you maybe have not yet posted. We'd love to see a post from you. Jean, if you could unmute yourself, we'd love to hear from you.
Hi, how are you today? We have at the Foundation for Enhancing Communities, we have developed a early childhood resource center for families. We work a lot in our communities with school readiness. So in this time, we had decided it was probably best to do a resource center for families to access and early learning providers to access. So we put information on there about the COVID-19 and how to talk to your kids. There's some stuff out there. Sesame Street had that great workshop yesterday. There's links to that on there. There's also activities for families to do at home that they can start working on school readiness and reasons why we do the activities and what does school readiness look like, and relaxation things at home. We also tried to incorporate some trauma-informed practices on there because we know this is a stressful time for families. But we tried to put it all in one place for people to go to. So that's why I added the link in there with the TFAC with the Early Education Resource Center.
Thank you.
Thank you.
That's fantastic. Where are you based, Jean?
We're in Harrisburg, Pennsylvania.
Okay, good to know.
Thanks for joining us. That's awesome and great.
We're enjoying your weekly calls.
Thank you. Carolyn, I invite you to share your comment. Okay. Elizabeth, do you want to unmute yourself and share yours? Are you still here?
Yeah.
Oh.
Yeah, can you hear me? I don't have my earphones on.
Yep, we can hear you just fine.
Okay, so mine is just, it's a real, a real situation where someone have interested in treatment, but is very isolated because of COVID-19 and is being cared for by someone, who's been hired to be helpful. It's not a family member. And it just seems like, there are online, the telehealth is a very valuable thing for people who are interested in treatment. But if you have someone who's not interested in treatment, how do you get help to the person, a family member or home health person, to help reduce harm in those situations?
Thank you.
So that's a question you're asking to the group. Elizabeth, you're looking for some feedback?
We probably won't take any time to discuss, you know, some of these ideas, but I do invite everyone to continue the discussion on our website. I want to invite Emma. I see you there. Yeah, I invite you to share your comment. Thank you.
Yes, and so I usually work in the home with high-risk families, going into the home, teaching them parenting skills. And so we moved to virtual visits if they're interested. But I'm just trying to figure out like how to balance seeing how much they're struggling if they're not really reporting it, and how to connect ACEs with it. And so we can like give them more resiliency without overloading them with too much information. Because I feel like we're having so much information coming at parents for resources that they might become overwhelmed with it. So how we can do the best way to promote resiliency within families without making them like
Karen,
shut down because it's too much information. If that
Karen,
makes sense.
Can you talk about anticipatory guidance? You know, just maybe like
Laurie, like you're after my own heart. Thank you. Yeah. So I think that thanks, Laurie, and thank you to Emma. I really appreciate your lens, and seeing people in their homes is so different than seeing them in an office setting. I think what you bring forward and your what you've learned is really relevant to this conversation. So I'm grateful that you bravely spoke up. You know, you leaned in. That's awesome. But in terms of anticipatory guidance, what I would like to think about maybe is framing. So when I think about substance use, I think reflecting back on what Elizabeth's talking about is thinking about the stages of change. Like, where are people? And are they even receptive to this information, right? If we're going to give information to somebody who can't even hear it, we might feel like we checked off a box or we completed a task we were supposed to do, but we didn't really help somebody in a way that they needed to be helped. So I think I appreciate the question, and Laurie, and that Emma brought forth her comments as well. I think this is a really dynamic time, very difficult dynamic time. And if we could just kind of have in our back pocket some frameworks that might guide our work, whether it's motivational interviewing, you know, helping a person come to their own understanding instead of telling somebody. You know, telling somebody is very efficient. It's very fast. You can do it, but it isn't necessarily the best way to really affect change and empower somebody for future steps. So I think we could almost have a whole conversation, a whole call, seriously, on ways to really communicate. Yeah, so communicate like both from your heart, but also with built on a foundation of science and research. So before the call today, Laurie and I were talking about, like, eons ago when I was a young nurse, I was able to be part of a Touch Points project that Barry Brazelton presented or led. He was one of the first ones, a Touch Points at the Napa Valley. So
why don't you remind people who Barry Brazelton is, for people who don't know?
Oh yeah, like I'm kind of showing my age, huh? So Barry Brazelton is really a leader in child development and recognizing the relationship. If you remember, he will hold a baby and ooh and ah and stick his tongue out, and the baby will mimic him. And what he's really showing early on are that serve and return, right? Where the baby communicates and you respond, like that back and forth, which is really critical for all the brain development and all the goodness that we want to happen. So he was trying to take that kind of knowledge and bring it to people so they could operationalize it in their clinical practice. And talking to Laurie earlier today, it's like, how do you see, 25 people a day and hold in your head that important golden nugget that they shared with you, that that was done in trust and was form of relationship building. So in the old days, what you could do is have sort of a note, like somebody told me about a family member who was ill or something, and I would just have a little note or something about that, or something good, like I noticed something positive about them. And then the next time we come together, we can start there. We don't have to start from scratch and I have to reorient myself who that person is, but instead we can scaffold on that relationship, which builds trust and helps, even though we might go more slowly by using motivational interviewing and other techniques, it will be a richer, more, a stronger foundation in terms of moving forward in our relationship as we work together. So yeah, this could be a whole conversation.
Yeah.
and there's probably folks on here that would want to explain who Barry Brazelton is in a better way, or expand on anticipatory guidance, but please do if you'd like to, or if you, I think Laurie, you were already saying that. I don't know if we're coming close to our time, but if you have ideas on topics that would be meaningful going forward, that you'd like us to kind of hold this space for, please let us know. I was sort of thinking maybe that was what Emma was presenting when you were talking about that, Emma, like maybe a deeper conversation with some resources and folks to speak. Yeah.
That'd be awesome.
Yeah, that would be great. So if anybody else has some, and also I want to just quickly say that I'll go ahead and share some resources in the form of a blog, and maybe with maybe we can copy in some of the comments from this blog, from this chat, and de-identify people. So we'll just have the questions, the comments, and we'll make sure that it's not identifiable. It's just mostly the concept that was shared, or the idea, or the thought that was shared, if that's okay with people.
Yeah, so we are going to go ahead and wrap this one up. And this has provided a lot of great new ideas for future conversations that we can continue to have. And so thank you so much, Karen and Laurie, for leading this discussion. And thank you all for all of your amazing comments and contributions. Wow, so much good stuff here. I've dropped in our email addresses, so please feel free to reach out to any one of us at any time. Any concluding comments here, Karen or Laurie?
I have one plug if it's not too. So we're ACEs Connection, and right now we're all, we are shelter in place. We're working virtually as we're doing with this virtual call or meeting, Zoom meeting, for folks who are out in the communities and they still have, and you have a desire to take action. And let us know, reach out to us if you would like to establish an online group, like an ACEs Connection community for your site or for your location or for your group of people who are already doing amazing work, but maybe haven't yet had the opportunity to establish a site on ACEs Connection. Maybe now with folks doing the shelter in place, this might be a valuable time to establish that opportunity to collaborate virtually and continue to grow the ACEs work that's happening in your community. I think that would be great. So that
I just want to add to that to wind up, which is another plug, which is basically to say that ACEs and Pediatrics has that name. It's based on how we're funded, but it's really more expansive than that. It's not just pediatricians. It's everybody who is somehow connected in a constellation to pediatricians. So I do want to encourage people to also sign up for ACEs Pediatrics and join the conversation there. And thanks so much, everybody. And I look forward to more conversations with everyone.
Yeah, thank you all so much for taking time out of your day to join us here and add to this very enriching conversation. And we value you and your time so much, so grateful. Thank you again, Karen and Laurie, for being such wonderful hosts of this conversation. And we look forward to seeing you all on our website to continue the conversation and to see you back here, same link on Tuesday. We will publish some information about that on Monday, but know that we're doing a recovery theme on Tuesday. All right, everyone. I hope you have a great weekend.
Thank you. Stay safe and connected. Bye-bye.
Bye.